First of all, I would like to thank you for the opportunity to present the results of our study today. This study is sponsored by the Research Foundation Flanders. We have no other affiliations to disclose. Colorectal cancer is the second most common cancer in women and the third most common cancer in men. Nearly 40% of these tumors are located in the rectum. Standard of surgical care for rectal tumors is a nerve and sphincter-sparing total mesorectal excision. By performing a TME, the anal sphincter as well as the surrounding autonomic nerves are spared. However, the rectal reservoir as such is lost after excision. Thus, in many patients, a TME results in a wide range of bowel complaints, often referred to as low anterior resection syndrome. Due to the complexity of this syndrome, a consensus definition was recently defined where one can speak of LARS if there is at least one of the defined symptoms present, such as unpredictable bowel function, that in turn leads to one of the defined consequences, such as toilet dependence. Considering the fact that there are a lot of patients and that symptoms may vary between patients, a good screening and evaluation tool is necessary. The aim of the study is to investigate whether the different LARS symptoms can be sufficiently well evaluated by one or two questionnaires, and this compared to the stool diary in rectal cancer patients after low anterior resection surgery. In this study, data from 77 patients treated for rectal cancer was included. All of these patients underwent a total mesorectal excision and were recruited in 3 different hospitals and filled in the LARS and COREFO questionnaire and the stool diary at 1 month following surgery, or in case of a temporary ileostomy, 1 month after stoma closure. The LARS questionnaire consists of 5 questions specifically designed to clinically evaluate the severity of LARS symptoms after low anterior resection for rectal cancer. Each question has its own weighted score value for each of the included domains. The COREFO questionnaire is a less known but broader questionnaire in which each question is scored on a 5-point Likert scale for each of the items. Besides these questionnaires, which are designed to be filled in at one point in time, the stool diary could be considered to be the golden standard measurement method since it records every bowel movement and stool leakage episode in detail. In contrast to the questionnaires, a diary represents objective, real-time occurrences which results in multiple parameters that can be derived. Participants were asked to keep track of frequency of bowel movements, anal incontinence, urgency, clustering, and soiling during 7 consecutive days. The LARS questionnaire, the COREFO questionnaire, and the stool diary use different scoring methods, a different number of questions concerning the same construct, and apply different values to the responses regarding the same construct. Therefore, the use of canonical correlation analysis was warranted. In canonical correlation analysis, the magnitude of the relationship between a linear combination of variables between 2 sets of variables is assessed. As such, a canonical correlation analysis can be seen as a multivariate analysis of correlation between sets of variables to identify the amount of shared information between the different constructs. For each bowel complaint, all corresponding items were selected in the different evaluation tools. This table provides an overview of the number of items used for every evaluation tool. In this study, the comparison was made between the LARS and the COREFO questionnaire items on the one hand and the stool diary items on the other, to determine the magnitude of the possible relationship. This is an example of items that were included in the analysis for anal incontinence for feces. For the LARS questionnaire, the second question was included. For the COREFO questionnaire, question 8 through 11 were included considering stool leakage. Finally, for the stool diary, the average and maximum frequency of stool leakage was included. Results demonstrated that items on anal incontinence for feces correlated significantly between the COREFO questionnaire and the stool diary. The fraction of information found in the COREFO questionnaire that could be explained by stool diary items was 13.5%. Analogous, the items on the frequency of bowel movements were significantly correlated between the LARS questionnaire and the stool diary. The fraction of information that could be explained by the stool diary items was 20.8%. COREFO items on frequency of bowel movements were also significantly correlated with the stool diary items. In this case, the fraction of information that could be explained by the stool diary items was 23.5%. Lastly, items on soiling were significantly correlated between the COREFO questionnaire and the stool diary, and 20.3% of information found in the COREFO questionnaire could be explained by stool diary items. The remaining items from the LARS questionnaire and the COREFO questionnaire did not significantly correlate with the corresponding stool diary items, which means no overlap in information between sets could be found. In interpreting all of these results as a whole, we can conclude that both questionnaires are valuable tools in assessing LARS symptoms developed after rectal cancer surgery. However, only one item of the LARS questionnaire, frequency of bowel movements, showed sufficient agreement compared to the stool diary. For the COREFO questionnaire, 3 items showed sufficient agreement compared to the stool diary. Overall, moderate to high correlations were found, although the overlapping amount of information between the questionnaires and the stool diary was rather small. Therefore, we can conclude that both the LARS and COREFO questionnaire are efficient tools to evaluate specific LARS symptoms after low anterior resection for rectal cancer. However, neither of the questionnaire has the potential to replace the stool diary entirely. In order to evaluate all aspects of LARS, it seems essential to at least combine different questionnaires or ideally use a stool diary to optimize post-operative therapy for bowel complaints. Thank you for listening and sharing this online experience with me. I hope that next time we'll meet, it will be face-to-face.